A few weeks ago, actress Olivia Munn announced she had been diagnosed with an aggressive form of breast cancer.
Munn saying in a post on Instagram she was diagnosed with breast cancer after having a normal mammogram months earlier. She credits her doctor for saving her life by calculating her risk assessment score and sending her to get an MRI. Joining us this morning is that doctor who Munn called her guardian angel, global leader in her field, OB-GYN, Dr. Thaïs Aliabadi. Good morning. Thank you for being here.
Good morning. Thank you for having me.
So one of the reasons this story has been shared widely is the fact that Munn had received a cancer diagnosis after having a normal mammogram. Can you explain when a normal mammogram isn't enough in order to detect cancer?
Yes, so it's important to know that mammograms are very effective tools in screening for breast cancer. However, they miss 20% of cancers, especially in patients with dense breast tissue. And that's why it's important to sometimes supplement that ultrasound and MRI in addition to mammogram to catch those other 20%.
And how does one know whether one should do that? And if you just have questions or you're worried, what should you do?
That's a very good question. So first of all, 50% of women have dense breast tissue. If you have dense breast tissue, you need to have an ultrasound in addition to your mammogram. However, it's important for every woman on this planet to know her lifetime risk of breast cancer. And if that lifetime risk is 20% or more, in addition to mammogram and ultrasound, these patients also need an MRI. So it's important to know what that number is.
And how do we know what that number is?
So in Olivia's case, I did a genetic test with Myriad called MyRisk.
Okay.
And I also calculated her lifetime risk using a formula called Tyrer-Cuzick risk assessment tool. This is a tool that predicts a woman's lifetime risk over 10 years and over her lifetime. If that lifetime risk is 20% or more, these patients need to start imaging as early as age 30, not 40, and they also need to supplement with ultrasound and MRI almost annually.
Okay.
And do you have to go to your doctor to get that sort of calculation done, or is there some way that I can do it right now?
So actually, because of everything that happened, I uploaded this calculator on the SheMD podcast website. Women can go calculate that risk for free, and I have action plans ready for them to know. So if you're 15% or less, you just do routine mammogram starting at age 40. If you're 20% or more, you start imaging at 30, and you do mammograms and ultrasound, and you alternate it with MRIs every 6 months. If you fall into that intermediate category between 15 and 20%, you can start your mammograms at 20. And if you have dense breasts, you add ultrasounds. However, every few years, these patients might benefit from a breast MRI. Okay. So all the information is on the website. It's free. They can go calculate their lifetime risk. And I also want to point one more thing, that for patients with family history of cancer, it is important for them to do a genetic test, just like I, did on Olivia Munn. And, Myriad, you can go on their website, take a home test, and see if you carry it, if you carry any gene mutations.
I just dealt with this week, getting a mammogram and an MRI, but you need to ask your doctor to put in that order. I was faced with that, going, you can't get an MRI because your doctor has to call them in advance and say, I would like my patient to get an MRI. So for women who schedule the mammogram and would like that extra testing, you have to go through your doctor.
Yes, and that's why it's so important to know what this number, what that lifetime risk number is. Insurance companies will approve your breast MRI if your lifetime risk is 20% or more. So if your doctor just writes a breast MRI, 9 out of 10, it's going to not get approved. But sometimes, we get on the phone with the insurance companies, and we have it approved because of that lifetime risk.
What are things that people can do to lower their chance of getting breast cancer?
Maintaining a healthy weight, exercising, avoiding alcohol, avoiding, smoking. Just a healthy lifestyle overall will lower your risk of breast cancer. But 1 out of 8 women will get breast cancer in her lifetime. So it's important to know your risk.
And just to drive this point, I think even more for people, even though the mammogram did not work in this case, mammograms are important. The guidelines, again, for people watching this morning that maybe haven't had one before or haven't had one in a while.
So if your lifetime risk is below 15%, you start at age 40. If you have dense breast tissue, you add ultrasound to your mammogram. If your lifetime risk is 20% or more, you start your mammogram and ultrasound at age 30, and you alternate it with MRI as needed. So it's important to know not everyone starts at age 40.
Right.
I'm sure Olivia Munn's life was not the first you saved, but thank you so much for doing that and for everything you do.
I love her, and I'm so proud of her for bringing so
Yes.
much awareness to this. She's going to save millions of lives.
Yeah.
Wonderful.
Thank you,
you very
Doc.
much.
Thank you so much.
Dr. Aliabadi mentioned the place where you can get all of that information and you can take that test yourself. She has a weekly podcast. It's called She MD. She empowers women with the knowledge and tools to become their own health advocates. For more information on that and to access that breast cancer risk calculator, go to shemdpodcast.com.